Workplace drug and alcohol programs, which include testing, are now commonplace in New Zealand and overseas, particularly in companies involved in safety-sensitive industry sectors. And why is this? There are a couple of overlapping drivers. Initially, there is the increase and change to the misuse and abuse of drugs in New Zealand, as well as the ongoing misuse of alcohol. And superimposed on this, there are very strict health and safety requirements imposed by the Health and Safety and Employment Act. And this legislation requires that both managers and staff identify hazards, manage them, and where possible eliminate them, and a drug and alcohol impaired person is identified as a potential hazard. Therefore, drug and alcohol testing are both effective ways to identify this particular hazard. We have also had a number of important employment court judgments influencing drug testing direction in New Zealand. The first of these was in April 2004, which was a case involving 6 unions challenging the Air New Zealand's drug and alcohol policies and procedures. Because the parties could not come to an agreement, the hearing was advanced to the Employment High Court, and I was an expert witness in that trial. The judges then took 6 months to deliberate, and their final judgment was that Air New Zealand can randomly test those staff who are in safety-sensitive jobs. All staff can come under the umbrella of post-accident, post-incident, and reasonable cause testing, and pre-employment testing was not challenged. However, if drug testing was to be undertaken, it must be carried out in strict compliance with the most recent high-quality international standard, and the latest urine standard is AS/NZS 4308/2008, Procedures for Specimen Collection and the Detection and Quantitation of Drugs of Abuse in Urine. And the final point is that testing must fit within a comprehensive program. And by that we mean that there are a number of steps that are involved in a comprehensive program. The first step involves developing policies and procedures which are legally robust, operationally sound, fitting the culture and mix of jobs in a company, and they must have gone through a robust consultative process. Whenever a company reviews and substantively updates these policies and procedures, a similar consultative process should be repeated. The second step is conducting training and education programs for both staff and managers, and ideally this should be part of the consultative process. So this e-learning module covers the same material as the staff classroom training sessions. However, managers and supervisors should then also undertake an advanced training workshop where they gain a lot more information on the signs, symptoms, behaviours of a substance-impaired person, how to identify these individuals, and how to manage the situations within the boundaries of the company policy. The third step is testing in strict compliance with the latest Australian New Zealand standard 4308/2008 and also the strict criteria for alcohol testing. And then the fourth important step is what will companies do if a person is identified as having a drug or alcohol problem. And most New Zealand companies do have some rehabilitation component in their program, which a person can voluntarily access if they believe that they have a problem and wish to seek help, or if a person tests positive for the first time, he or she may be given the opportunity to undertake rehabilitation, but this would normally be at the discretion of the company. And I will address this component of your policy, of your company policy later on. Overall, these programs are about addressing safety, focusing on a person coming to work and not posing a risk to themselves, fellow workers, or in the case of transportation industry, for example, the general public.